If I don't inject, I can't cause a complication. No needle, no danger. That's just good math.
Hi! Quick touch-up between the brows and a little on the nose. I've got a meeting in 20.
Between the brows and the nose, that's the danger zone. Both of them. One wrong move and the finger hits an artery. The skin dies, or worse, you go blind. And it's all my fault. Dr. Ray, tell me I'm overthinking this.
You're not. The worst risk is real, filter in an artery. So let's turn that fear into a method. Filler here can travel backwards up the artery all the way to the eye.
And you go blind.
Exactly. And the anatomy is different in everyone, so it's never luck. You learn where they run and how to treat it fast. Normally, the blood flows through the vessel, smooth and steady, feeding the skin. But if a filler gets into the artery, it doesn't flow. It plugs it, like a cork, a blockage. And everything downstream loses its supply. The tissue dies. And if it's the vessel to the eye, your sight goes with it. But knowing the danger is only half of it. The other half is technique. Let Dr. Ray show you the way.
Feel for the nasal cartilage. Tiny poke, 1, 2, 3. Tip, always have a gauze on your non-dominant hand to stop any potential bleeding. Gently slide your cannula along the cartilage and then to the bone. Very gently. Do not use too much force. If you encounter any resistance, if you force it too hard, sometimes it gets out from the mucosa inside the nose. So be very gentle with nose injection. Slowly reach all the way up. By tilting upwards, you can see the tip of the cannula pinching on the skin. So that's how you confirm the position of the tip of the cannula. So go all the way in, tilt, and you can see the tip of the cannula. And then slowly inject, staying on the midline, slowly inject, and withdraw at the same time. Do not inject too much, otherwise the pressure from the filler coming out from the cannula, sometimes it will spread sideways, and you get widening, migration of the filler. So back and forth, go back in, retrograde, gentle volume along the midline of the nose. And then going back in, midline, retrograde, small volume along the midline of the nose. Small volume. Do not inject too much. And then you can turn your cannula towards the columella by improving the anterior rotation of the nasal tip. So sliding in the space between the skin and the cartilage. Sliding along, and then inject one bolus at the anterior nasal spine. Stop injecting, withdraw a little bit more to create more anterior projection. One bolus at the anterior nasal spine, second bolus along the columella, third bolus at the inferior tip. And final step of a nose injection is to use a Q-tip to roll down some of this filler to the side. So have one non-dominant hand with your finger on one side, your not dominant hand on the other side to roll down the filler, to roll it down so that you don't get a shadowing, especially on the sides of the nose. So the curve from this will be more natural. Roll it down a little bit. You roll it down. Roll it down. But remember, you do not roll too hard on the midline. Otherwise, the filling effect from the midline will be diminished. So what you want is just a little bit from the side to roll it down the hill to create a natural curve.
And you always watch for trouble. Sudden severe pain, skin turning paler, blotchy, any change in vision. The second you see it, you stop.
And if it does happen, what do we do?
Hyaluronidase is ready before you ever inject. High dose, right away. With the eye, every single minute counts.
I understand now. It was never about fearing the risk. It's about understanding it and staying in control. New rule: slow and small volumes during injection.
And just like that, the danger zone is only a zone. Know the anatomy, go slow and small volumes, keep the rescue ready, and feel the path, never force. That's the Dr. Ray way. If you like this video, please like, subscribe, and tap the bell.